Made in Canada, eh? Well, this is not the kind of thing that you want to experience being made in Canada. I'm Rosemarie Havsom. I'm back again to let you know that you can take full control of your life by what you choose to put at the end of your fork. So let's get into it.
You remember back in 2016 when everyone who said, like, if Trump wins, I'm gonna move to Canada. Canada was the vibe. Canada was the beacon for every argument. That's better than the USA. The healthcare is free and all that stuff. Well, I guess Canada is not the vibe anymore.
Pros and cons of living in America, and everyone's like, oh, Canada's so great, this and that. It's not anymore. Free healthcare. You know how long it takes to see a mental health professional in Canada? A year. Dermatologist, a year. I might as well pay for private healthcare. The wait list is so long. Like, you don't even get the adequate help that you need. So where do we go at this point? Where are we supposed to live? Where can I live in a place where I'm able to enjoy my life as well?
So I guess Canada has an age well. Canada is not the vibe, and pretty much Canada has something called MAiD, medical assistant in dying. So we're at the point where Canada's healthcare system asks you first, have you considered dying?
Made in Canada, eh? Well, for all of our US friends, let's focus in on Canada. Canada's been known to be the Great White North. It's the place where you go to enjoy outdoor activities and sports all over this country because we have such a wide range of climates. But generally, it's mostly all cold. But anyway, being made in Canada has taken on a whole new meaning. And that is, it's an acronym for Medical Assistance in Dying. You heard that correctly. Canada is now trying to kill people, or at least help them unalive themselves, or as some people call it, just murder people, or as other people call it, mercy killing, or as other people call it, euthanasia. They're all the same, depending on what your outlook is on it. So there are some things that are created with good intent, but in some cases and in a lot of cases, such as this one, it may not be the intention that people thought it would be when they came up with this bill.
Happens is that the person is sedated so that they're relaxed, then they're paralyzed so that they can't move, and then their heart is stopped.
Medical assistance in dying. It's about compassionate care, is what they say, to enable people that are in excruciating pain or that are going through the end of life phase where pain is intolerable and cannot be controlled by medical means, or that there is no hope of recovery for them. So this could be anywhere from the range of someone who has terminal cancer and is suffering due to the ravages of that horrible disease, all the way to somebody that is considered to be brain dead and is in a coma, but is still somehow alive. And then again, there's the issue of our older generations, our seniors, who may not have family members to care for them and may not be able to afford these assisted living, if that's what they require, or even retirement living. It's a wide range of issues that are all under the umbrella of MAiD. Now, of course, to be eligible for this program, it has to be that it's a voluntary thing. So nobody can coerce you into getting into this program if you don't want to. So number one, it has to be voluntary from the person in question. It has to be somebody that is at least 18 years of age and has their full mental capacity. So it cannot be anybody that cannot think or have any sort of cognitive issues that would prevent them from making reasonable decisions about their health and end-of-life care. Some statistics that we need to follow when it comes to Canada and our healthcare system. Now, of course, our friends in the US know that it's all about the socialist agenda. No, it's all about the socialist model of healthcare and life in general in Canada. So yes, there's universal healthcare here. There's also a universal way of looking at healthcare. Now, unfortunately, over time, healthcare costs have risen astronomically, and people's access to the healthcare system has become strained due to many factors. One such factor is the downloading of covered procedures from the healthcare system that would be free to most citizens. There's been over the years a reduction in what kinds of testings, what kinds of programs are available for healthcare in the healthcare system for free. There's also now the issue of long waiting lists so that people who need the care cannot even get the care because of the extremely long waiting lists. And then added to that whole thing is the abundance of people who are accessing the healthcare system for things that are not emergencies, for example. They're blocking and filling emergency rooms for many reasons. One of them is that they cannot find a family doctor. And another reason is that people just want to be able to be seen sooner rather than having to wait for a doctor's appointment, especially when it comes to specialists appointments. These are so many factors that have been ravaging the Canadian healthcare system. People who voluntarily wanted to end their life within the realms of the given eligibility criteria were able to do that. Now, this is very interesting because a lot of people who were suffering from catastrophic physical injuries or catastrophic brain injuries would then be eligible to participate in the MAiD program. So what do we have here? Well, what wasn't passed was that the MAiD program could have included 12 to 17-year-old children. Now, that part of the MAiD program agenda was struck down. But what we do know is that people with mental health issues were also wanting to access the MAiD program. And that, again, has been delayed in this case, has been delayed until March 2027. So just in a little over 2 years, people with mental health issues that feel like they have no other option will then be eligible for the MAiD program. Now, call it what you will, but let's take a look at what it really is. The other names for MAiD is euthanasia. People don't like to admit that when it comes to what the terms really mean. If we really break it down, medical assistance in dying is the same as euthanasia. It's all about this quote unquote compassionate care. This is a trope that has been used since World War II, where the Nazis were spouting the idea of compassionate care while they experimented on how many millions of Jews. It didn't just end there, because people have been experimented on. The sick, the poor, the uneducated, the mentally disabled have been experimented on for decades in North America, and even in many instances for centuries. We can go back as far back as slavery to see what some of the very sick ideas about how to administer medicine, where they experimented on Black women, for example, to learn more about gynecological issues and how to cure them, while experimenting on a woman who's alive with no anesthesia, no pain control whatsoever. So we've seen things like that. We've also seen with the Tuskegee Airmen and how they experimented on men, on the Black men who contracted syphilis to see how badly they would suffer and what their end would be in the progression, the full progression of syphilis. We've seen those kinds of things, and Canada has long been hiding a lot of its diabolical agendas under the assumed persona of the compassionate and friendly Canadian people who are polite. But that world is changing. Canada's not the same Canada that it used to be decades ago. We now have people that are having extreme difficulty accessing healthcare for basic healthcare needs. We have people who are mentally ill that are not able to access mental health care, because that was considered to be something that was subhuman in how people with mental health issues were treated. So all of our mental health institutions were emptied out. And where did they empty out the people to? To the streets. But that's a whole other side of Canada that we're not hearing about. We're now undergoing and seeing such a homelessness problem in all of the major cities in Canada. That's not reaching the news very much at all.
This is Toronto, the city where you have to be rich to survive.
This is not my Canada, where we're not taking care of our people.
How much do you think a room is downtown?
$2,500 probably.
Yeah, I get 900 from the government. What am I gonna do with the rest?
As rent prices chase new all-time highs, with the average one-bedroom apartment priced at $2,700 per month, Ontario sees its highest homeless population to date, sitting at an estimated 81,000 homeless people, causing the city to turn to more drugs.
What else you got cooking here? Is that a meth pipe?
Yeah, I'm hydrolyzing meth.
Chaos.
You think the Prime Minister of Israel is worse than Hitler?
Yeah!
Why?
Worse than Hitler.
Get out! Now!
And violence.
What you doing? Just put out the joint! What you doing? Put out the joint!
Exactly 1 year ago, you might have already seen me come to this city and talk to the homeless directly. More recently, the city's seen the addition of tiny homes like this one being rolled out to the homeless people from a non-profit organization. And at the time of recording this video, they're fighting a legal battle against the government to put a stop to their production.
It's a completely different landscape when we look at the Canada that once was and had the reputation of being polite and friendly to the Canada that is, with all kinds of petty crime and all kinds of mental health issues, physical issues, inability to access healthcare, and people who are abusing the system as well, making it worse for others. And now we have MAiD in Canada. What do you think is going to be the outcome of MAiD? There have been some people who've been looking at who are the vulnerable sectors when it comes to a program like MAiD. We're looking at seniors, the most vulnerable of our society, seniors and children and young adolescents, our senior citizens who have to decide how they're going to live out their final years, either with assisted living or in retirement nursing homes. And these are getting more and more expensive. So if we know that with end-of-life care, palliative care can be done away with MAiD, then that would save the country between $34 million and $138 million a year. Now compound that over how many years that this program would be in effect. And what do you think that that is doing? Well, it's saving the government millions of dollars, hundreds of millions of dollars on healthcare that there's no way that they can catch up on. If people are able to voluntarily take themselves out of life and end their life legally, there goes a big part of the problem. Now, the scary part of it is the coercion that is being talked about anecdotally on social media, where they're saying that there's been applied pressure, that hospitals have applied pressure to family members of critically ill patients to end their lives. And not just critically ill patients, but patients who are elderly, who have nothing else happening to them, but just that they're old. There's absolutely an opportunity for abuse with MAiD in Canada. And it's really making us having to wake up and take a look at what our government is doing, because we forget that we are the ones who put the government in power. I think people forget that, or because we become so apathetic that we don't even have the energy to vote anymore. So therefore, all kinds of programs and policies are being enacted that are absolutely against the dignity and the health and welfare of Canadians. We have to look at it. But you know, it's very interesting how everything is tied together. The healthcare system, the food industry, and the insurance industry. Those three are all together when it comes to the quality of life in this country. If Canadians really looked at how closely related medicine, insurance, and food are, they'd probably make better decisions when it comes to what they're choosing to eat. The problem is that processed food is a lot cheaper than healthy food. And when you look at it logically, that shouldn't be the case, because if you don't require a whole lot of pesticides on organic foods and healthy foods that you do on the industrialized foods, then why is it so much more expensive? Made in Canada absolutely needs to be looked at. Now, some people will fight and say that we need it, but then we have to look at how are people being euthanized in a compassionate way. And when you examine what that looks like, it's not a pleasant thing.
85% of those bodies showed a 2 times level increase of water in the lungs. So what was happening is when this drug is pushed, it causes a drowning, and it's stated as akin to dying by waterboarding or drowning. Meaning, the reason people in Canada who are given MAiD seem peaceful is because they're giving a paralytic first. So they're completely paralyzed, then this drug is administered as one of the 4, and they start drowning to death. They're drowning to death. We waterboarded people in Guantanamo. There's a reason we had to stop. It falls under cruel and unusual punishment. Yet we are having people like dying with dignity say that this falls under compassion and empathy. When you're drowning people chemically to death.
85% of all of the people who have lethal injection, which is one of the ways that MAiD would use to end a person's life, 85% of the people that experienced a lethal injection also experienced water in their lungs. So that means that they were drowning in their own bodies while they were given this injection, this lethal injection. And of course, the thing that made them not fight against that medicine was they were, number one, they were given a paralytic so that they couldn't move. If that's what they're using for the MAiD program, as a part of that program, then we have a moral dilemma, and we have a moral duty to look at other ways to treat end-of-life care in a way that really is compassionate. Because compassionate care is a whole different meaning when you look at the significance of what's going on under that umbrella. What do you think? Have you thought about end-of-life care and what that means? Have you heard of the MAiD in Canada program? Comment it down below what you think about this program and do your own research. There's a lot going on in Canada. Don't let the polite representative of Canada fool you. Comment it down below what you think, and if you have any questions about the MAiD program, please let us know. And don't forget to like, share, and subscribe to this channel. And please remember that I too have a YouTube channel. It's called Havsom. That's spelled H-A-V for Victor, S-O-M for mother. And we'll continue the conversation there. To your good health. Bye-bye.